Assalamualaikum warahmatullahi wabarakatuh. My name is Mohamad Osman, and today our group and I will present about the last chapter, which is responding to work and personal related stress. So before we get to the main subtopic or main topic of the presentation, what is stress? So stress is a tension between in your physical or even emotional state. So it is something that can make us go angry, sad, or even just feeling of relentless, feeling exhausted. So there are many ways how stress can affect our lives and how we can change or reduce our stress. So in this presentation, we will try to cover all of it. So please. Okay, so the first topic is factors of stress. So when we talk about stress, there are two main events happening simultaneously. So the first is the cause of the stress or the stressor, the external effects, and the second one is our internal effects of our body or our mental state. So this means that if something causes you to stress, you will respond in many ways, such as increased heartbeats or sweating, or even cause anxiety in certain people. So there are many causes of stress, such as where you work, the environmental where you work, or where you live, or where you study. Such example is when the office is too crowded or just too noisy, and also when the classroom with your student it is too noisy or just too much work at once. So it can cause a lot of stress. But all this stress, if we manage it carefully, it can be converted into positive stress. Okay, positive stress is something that pushes you to do something even better, or even pushes you to achieve your goal. Like if a due date, a deadline is chasing you, you will do your work more faster or more energetically because you want to achieve that deadline. So for example, you just have too many deadlines to chase in one time, like 3 or 4 more deadlines to chase in within a week. It can cause a lot of stress. Even positive stress, if it is too much, it can cause a burnout in your body. It can cause you to not think straight, just do whatever it is, don't care whether it's right or not, just to get the work done. So a lot of stress can really affect your mind and your thinking and even your physical state, because sometimes when you do too much or you stress too much, you tend to eat less or eat more sometimes. So yeah, there are many factors of stress, but we have to look out for each other. Back with me. So the next subtopic is major causes of stress. Now there are many causes of stress, but the major ones are, which we have gathered, is only 8, and you can add more, but let's not add more to the stress. So the major causes are 8. The first one is work-life balance. So what it means to work-life balance is some people, they cannot balance their work and their life. So which means that some people just tend to focus on work, and they just neglect their life duty. And some people just focus on their life and just abandon all their work duty. So this is not good, because one way or another, the other one, either the work or the stress, or either the work or the life, will stress you out. So you have to keep a good balance of it in order to achieve this minimal stress, because either way it will stress you out at some point. But you can try to reduce it, minimal it, by balancing both life and work issues. Alright, so the next point is long hours or irregular schedules. So what this means is that sometimes when you tend to do something or work or even just relaxing for a long time, just too long, or you have irregular schedules, like yesterday you eat at 12, today you suddenly eat at 2, and then next day you don't eat at all. Sometimes it can cause a stress anomaly in your brain, which causes you to overthink and then finally stress about it. So in order to avoid this, have a routine and then try to do something once in a while in your work progress. So if you have I understand, if you have like a long hours to work, right, you have to focus for 2 to 3 hours. Try to do some relaxing within like 15-minute interval or something like that, in order to reduce the stress on your brain. Right, so this is just the stress on your brain, not stress on your physical state. So in your physical state, you have to exercise a bit, or even just take a walk, for a brisk walk, 5 to 10 minutes, because sometimes we do have to work for a long time. The third point is change. So change is something which happens every day in our daily life, whether we like it or not. Change is something which means that yesterday or last week, last month, you had a different supervisor or a different method of work. Suddenly this month or this week you have a new supervisor, and that supervisor wants a new style of work. It wants it done his way, not the previous supervisor way. So this is an example, but sometimes this can cause stress because we are so used to the old ways that we have a hard time to adapt to the new ways. So this, if we cannot adapt, then the stress will come. And sometimes change is not just always about literally change, but sometimes also a change of deadline or due date at the last possible minute. So what this means is that it can cause you to overthink and also to not better manage your time. The next point is multitasking. So this is something that even I occasionally do in my studies or whatever I do. You tend to do multiple things in one time. So sometimes even when you're playing video games, you tend to listen to music, playing the game itself, and also trying to chat with your friends. This takes a toll on your mental state because sometimes it is better to only focus on one stuff than to focus on many stuff but not focus at all actually. So in work related stuff such as this presentation, if we do not commit ourselves to this presentation, if we try to do this presentation while also eating lunch, it will look impossible, it will look ridiculous and look unprofessional. So this means that if you multitask too much, you tend to stress because you cannot achieve even good results in either one of those tasks. So try to avoid multitasking if possible, but if you're good at multitasking, it can actually make your day better, but also remember to handle your stress well enough. The next one is incompetent leaders. So this usually happens in group works or just in any work related stuff. So so because we've all been a group work before, right? So incompetent leaders, what it means is leaders that are not actually doing their jobs. I've met this kind of people personally in my experience. I've met this kind of people many times, but it's okay. If they are incompetent leaders, then we must be the good leaders, even if it is unofficial, right? So in order not compete but to stabilize the incompetent leaders and our mental state of stress, so we have to make our own schedules, try to follow the incompetent leaders order, but also try to achieve what it is needed to be done. Incompetent leaders sometimes can order you to do stuff without any logic or any possible any logic. So we have to outstand them by any positive way. So the next point is a bit serious. It is a family or family transition. What this means is maybe it is the birth of a new child, or even death, or even divorce, marriage. So I am sure we've all experienced this before, so I'm not going to go too deep, but just on the surface that sometimes things will change in our family lifestyle. Whether it is the addition of a new family member or the loss of a family member, we have to learn to cope with it positively. And yes, it sometimes it will cause stress, especially the death of someone you love, but that is where our strongest point will continue, because that is where we are tested. So the next point is rumination, or just repetition of what you think over and over. So basically, this is overthinking. Rumination is just overthinking the negative past of your life. So of course, even me myself, I tend to do that because sometimes we do something we're ashamed of in our within maybe 3-4 years back, right? We are ashamed of it, but it's okay. Humans learn from experience or from our past mistakes. So even if we did something bad, or just not bad, there's something shameful to ourselves, we take that as our jumping point, our stepping point. Because if not, we tend to overthink about it, and then stress will come. And when the stress comes, we tend to overthink about the stress, and then it will just overlap each other until we seek help. So the last point, the eighth point, is noise pollution. This is a bit something maybe a bit minimal only, but in Malaysia it is true actually. What means by noise pollution is a large amount of noise which is very annoying to our ears, whether we be at work or at home or even studying. Personally, I've experienced this before because I currently this online semester whenever I try to do even videos like this, sometimes a car or a motorcycle will just roam through the streets and then ruin my video. So I have to retake this video like 3 to 4 times due to this problem. Actually, even right now, I'm trying to avoid any traffic going in front of my house since I live by the roadside. So this causes stress whether we like it or not. Even if you have experience driving, I'm sure some of you are driving, sometimes the noise pollution, like when people honks their car or even when the motorcyclist tends to revs their motor, it causes stress. Like, we don't want to know what that stress is, but it causes stress anonymously, right? So that's it for the major causes of stress. My group members will present the other points. I'm sorry if this presentation is a bit slow and dragging because since it is an online semester, I cannot really communicate with my friends about life, a real world time. I can only communicate through Google Meet and WhatsApp. So thank you for your attention.
Hi, my name is Danish Muazzam. My metric number DCS 181005. So today I'm gonna cover a part responding to stress. So before I start, there's one article that I've been researched. It's from the Star. So the article the headline say 29% of Malaysians have mental problem due to stress. So the things I want to highlight is the patron of Malaysian Physiotherapy Association (MPA) said according to the 2017 National Health and Mobility Survey, 29% of Malaysians had depression and anxiety disorder compared to 12% back then in 2011. Another thing I want to highlight is most people find it hard to deal with the problem they faced at work and cannot handle the stress. And it is harder when the individual face problems from family members and do not receive any emotional support, which is that thing very related with our daily life. There is three elements of stress. With number one is the stressor. So stressor is basically a situation or a problem that um, can cause you to not solve that kind of problem. So that is a stressor. So number two is your perception. So perception is basically the ability to see, to hear, or things that become aware of something using your senses. And the number three is respond. Basically how you respond to that kind of situation. So our nature respond to stress called fight or flight syndrome. So basically it is a physiological reaction in response to perceived harmful event, attack, or even threat to the survival. So basically how people that suffer from stress and that kind of problem, how they respond and react, we can see from three kind of response. So number one response is basically the emotion response. The number two is behavior response, and number three is physical response. So by emotion response, we can see that they will suffer anxiety and also depression. In terms of behavior reaction, number one, they will suffer addiction. For example, like if they have a problem, they will drink too much alcohol until they get drunk, and some of them are smoking too much just to relieve that kind of stress. So aggression also one of a behavior reaction that we can see. For example, when they face that kind of stress, that kind of problem, they will blame other people on their own problem, on their own stress. And also, the worst case it will be is if you seen some people, kick an object, kick the wall, punch the wall, even punch the mirror for no reason. So it is basically how they reflect their feeling towards the situation they got. So in terms of physical reaction, obviously you can see that they will feel headache and also feel muscle pain because that, like I say, they punch object for no reason and so on. So there are many ways to respond to stress in a positive side, which is will cover from my friend. But I'm just going to tell 2 points that are very important for me. Number one, by establish mental, physical, and also emotion balance. What I mean by that is you need to do something that will help you to balance all of those three. For example, like get enough sleep, do exercise regularly, and also do a quick meditation is a good things to do in terms of balancing three of those that I just mentioned. So number two is perceive stressor as a challenge rather than a threat. What I mean by that is instead of you just see that kind of situation, okay, this is my problem and I cannot solve the problem, so I'm just gonna admit, and then I get stressed and then I do things like drinking or smoke or things that is not benefit. So rather than think like that, change your mindset. Think that okay, this is a challenge. I need to settle down instead of just do that kind of thing. So by doing that thing, you change your mindset and you change yourself from become stressed to become successful and better person. So I guess that's all from me. Thank you.
Warahmatullahi wabarakatuh. My name is Muhammad Albayhaki bin Abdul Jamai. My matric number is TCS 192002. So my topic is the signs of the stress. Stress that continues without relief and can lead to the condition called distress. A negative stress reaction. Distress can disturb the body internal balance or equilibrium, leading to physical symptoms such as headache and upset stomach, elevated blood pressure, chest pain, sexual dysfunction, and problem sleeping. Emotional problem can also result from distress. This problem include depression, panic attack, or other form anxiety and worry. Stress is linked to 6 of leading causes of death: heart disease, cancer, lung ailments, accident, crisis of their liver, and suicide. Stress also become harmful when people engage in the compulsive use subtests of behavior to try relieve their stress. So signs and symptoms of stress overload. The most dangerous thing about stress is how easily it can creep up on you. You get used to it. It start to feel familiar, even normal. You don't notice how much it affects to you, even as it has a heavy toll. That's why it's important to be aware of the common warning signs and symptoms of stress overload. Cognitive symptoms like memory problem, inability to concentrate, poor judgment, seeing only the negative, anxieties or racing tone, constant worrying. Emotional symptoms like depression or general unhappiness, anxiety and agitation, moodiness, irritability or anger, feeling overwhelmed, loneliness and isolation, other mental or emotional health problem. Physical symptoms like aches and pains, diarrhea or constipation, nausea and dizziness, chest pain, rapid heart rate, frequent cough or flu. Behavior symptoms like eating more or less, sleeping too much or too little, withdrawing from others, procrastinating or neglecting responsibility, using alcohol or cigarette to relax, nervous habits such as nail biting and pacing. People can learn to manage stress and lead happier, healthy life. You may want to begin with the following tips, like keep a positive attitude, accept the event that you cannot control, be assertive instead of aggressive, accept your feeling, opinions or belief instead of becoming angry, defensive or passive. Learn and practice direction technique. Try meditation, yoga or tai chi. Exercise regularly. Your body can fight stress better when it's fit. Eat healthy, well-balanced meal. Learn to manage your time more effectively. Set limit opportunity and say no to requests that will create excessive stress in your life. Make time for hobbies and interests. Get enough rest and sleep. Your body needs to recover from stressful event. Don't rely alcohol and drug or compulsive. Seek out the social support. Spend enough time with those you love. Seek treatment with a psychology or other mental health professional in stress management, or by your feedback technique to learn more healthier ways of dealing with the stress in your life. Thank you. That's all for me.
Okay, my name is Mohamad Harrizt. My metric number DCS 181001. So for my part, I want to talk about stress management strategies. The first stress management strategy is avoid unnecessary stress. Avoid people who stress you out. Try to avoid them so that you will not get stressed by them. Second ways on stress management strategies is make time for fun and relaxation. There are healthy ways to relax and recharge. For example, like go for a walk, spend time in nature, work in your garden, get a massage, listen to music and watch a comedy. Relaxation also one of the stress management strategy, because if you get relaxed, you will get out from the stress. The third ways on stress management strategies is adopt a healthy lifestyle. You can increase your resistance to stress by strengthening your physical health. For example, like exercise regularly, eat a healthy diet, reduce caffeine and sugar, avoid alcohol, cigarettes and drugs, and get enough sleep. So that you can increase your resistance to stress by strengthening your physical health. So adopt a healthy lifestyle is one of strategies that you can apply to get rid of your stress. Next is take control of your environment. If traffic got you tense, for example like traffic jam, take a longer but less travel road so that you will not get stressed by environment such as traffic jam. Okay. So those three are one of stress management strategy. There are many strategies that you can apply to manage your stress. For example, like alter the situation that prevent you from stress. Try to avoid situation that will make you stress. Any situation that will make you stress, try to avoid them. Second is adapt to the stressor. If someone make you stress, try to control yourself to prevent the stress. Accept the things you can change. Don't try to control the uncontrollable. For example, like the situation that cannot be controlled, so you will get stressed by the situation. Look for the upside. Share your feelings with your friend so that your stress will be gone, because you will share your stress with your friends. And learn to forgive the person so that you will forgive them, because the person make you stress. There are other ways to manage the stress strategy, but the point that I've said like avoid unnecessary stress, make time for fun and relaxation, adopt a healthy lifestyle, and all of them are from my point on stress management strategy. So that's all from me. Thank you.
Assalamualaikum. My name is Shahmi Rushaidi bin Sani. Metric number DCS 181006. And today I'm going to talk about the popular therapy options for managing stress. Before that, I'm going to talk about the stress management. Many of us experience stress, and it is a common reaction to the difficulties of life. In fact, as with anger, some amount of stress is part of a parcel or a healthy mind. In some cases, however, stress can be too much to handle, preventing someone from enjoying their life and sometimes from doing daily tasks. Stress was designed to protect us in certain scenarios. When we are under real threat, stress serves as a boost to the system that helps us physically fight against or escape from it. When stress is a problem, it appears even when the individual is not under any imminent threat. There are different types of stress. Some of it is a chronic stress or disorder stress. There is some ways to manage stress. The first one is CBT. CBT stands for Cognitive Behavioral Therapy. It is one of the most common and successful interventions for managing stress. Patients use CBT to identify the negative thoughts and behaviors they experience. Then they work with a therapist to employ coping strategies by reframing their thoughts and eliminating negative behaviors. Patients can reduce stress in their lives to a significant degree. Mental health experts often recommend certain lifestyle changes for patients learning to manage their stress. Changes such as exercising more, delegating responsibilities to others, and finding healthy outlets can help patients to manage their stress more effectively. Other ways to manage stress is medication. Feelings of stress are a reaction to the things that happen in your life, not a mental health problem, so there's no specific medication for stress. However, there are various medications available which can help to reduce and manage some of the signs of stress. For example, your doctor might offer a prescribe of sleeping pills or minor tranquilizers. This is if you have a problem sleeping. Others like antidepressant. Antidepressant is used if you're experiencing depression or anxiety. And another one is a medication to treat any physical symptoms of stress, such as IBS or high blood pressure. Before deciding to take any drug or medications or pills and anything, it's important to make sure that you have the fact you need to make an informed choice. You need to ask your doctor's advice for the medications. Okay, next step is ecotherapy. Ecotherapy is a way of improving your life well-being and self-esteem by spending time in nature. This can include physical exercises in green spaces or taking part in a gardening or conservation project. The last one is complementary therapies. You may find certain complementary therapies such as yoga and meditation that can manage feelings of stress. These might help you manage your stress. Other than yoga and meditation, there is also acupuncture, aromatherapy, and massages. Okay, that's all from me. Thank you.
Hi, Assalamualaikum. My name is Firdaus bin Mustapha. My metric number is DCS 173001. So today I want to talk about using positive psychology to combat stress and coping with psychological disorder. So basically, positive psychology has been described in many ways and words, but the commonly accepted definition of the field is this: positive psychology is the scientific study of what makes life most worth living. Peterson 2008. To push this brief description a bit further, positive psychology is a scientific approach to studying human thought, feelings, and behavior with a focus on strength instead of weakness, building the good in life instead of repairing the bad, and taking the life of average people to grit instead of focusing solely on moving those who are struggling up to normal. Peterson 2008. Positive psychology focuses on the positive events and influences in life, including human experiences like happiness, joy, inspiration, and love. Next, states and traits like gratitude, resilience, and compassion. For the last is institutions, applying positive principles within entire organizations and institutions. As a field, positive psychology spends much of its time thinking about topics like character strength, optimism, life satisfaction, happiness, well-being, gratitude, compassion, as well as self-compassion, self-esteem, and self-confidence, hope, and elevation. Nothing that many people suffering from depression feel helpless as well. The subject provided inspiration, ideas, and evidence to back up many treatments for depressive symptoms, as well as strategies for preventing depression. Depression psychologists overly narrow focus on the negative, so much attention was paid to mental illness, abnormal psychology, trauma, suffering, and pain, and relatively little attention was dedicated to happiness, well-being, exceptionalism, strength, and flourishing. There are some benefits for positive psychology, such as positive psychology is that it teaches us the power of shifting one's perspective. This is the focus of many techniques, exercises, and even entire programs based on positive psychology, because a relatively small change in one perspective can lead to an astounding shift in well-being and quality of life. Injecting a bit more optimism and gratitude into your life is a simple action that can give you a radically more positive outlook on life. No respected positive psychologist would tell you to think about, act out, and focus on only the positive in life. Balance is important. Positive psychology was not established to replace traditional psychology, but to complement it with a positive that just as strong as psychology's negative over the last several decades. Okay, that's all. Thank you.